Hi everyone, I'm Dr. Anshuman Pancholi and I will be starting with the clinical course in this PG modules. Now, what all we'll be covering here, we'll be covering the long cases, we'll be covering the short cases, we'll be covering the OSCEs and we'll be covering the ward rounds in detail. Now, there is a gross difference in preparation for your NEET SS or your theory examinations and the clinical examinations that you face. The main difference is that when you're facing an examiner, there is a very little scope to make up things, right? Hota kya hai, theory mein you have an option to write whatever you want to write, maybe hide behind a diagram, and just get through with it. That is not what happens in your clinical examination, and that is why it is the most overwhelming part of your postgraduate preparation, right? Now, there is a slight difference in the preparation for both these things. Generally, those students who are good at theory also do well in their clinical examination, but that is not a rule. You need to have a particular orientations for doing a proper clinical course or a proper clinical examination of a patient. Okay? Now, the prerequisite is that you have to read SDAS and maybe SRB as well. Now, होता क्या है कि आप लोग हमेशा you tend to leave this part of your preparation towards the end. You generally wait for a long time, and just before the examination you suddenly wake up and you feel like let's prepare for the clinical part as well. But that is not how the approach should be. The clinical preparation has to go hand in hand. The maximum number of cases you can present in front of your consultant, जितने कंसल्टेंट्स के सामने आप केसेस प्रेजेंट करोगे उतने ज़्यादा यू कम टू नो अबाउट द क्वेश्चंस. द क्वेश्चंस आर एक्सट्रीमली इंपॉर्टेंट बिकॉज every examiner has a basic ground set of questions which are common across all the examiners, but there are some special questions which the examiner is particularly inclined to ask, whether it is his field of work or he is particularly inclined towards a topic. Now, this will only be revealed to you when you are presenting your case. So never shy away from presenting cases during your PG preparation. Don't leave it up to just one or two people. That is what usually happens, that most of you shy away from taking the cases. Don't do that, because what happens is that maybe in MS it's a bit more relaxed, but in the DNB courses it is extremely stringent. That is why the passing percentage is low. The passing percentages fall because of the clinical part of the course. You are sent away to places where you don't really know, right? You have to have about 1 month or 2 months of preparation time between the theory and the practical examinations, but you are there at centers where you don't really understand who is going to be the examiner, what the case is going to be. So your clinical part of the preparation has to be really good. How do you do that? Is that one is the basic set of preparation, that is by reading SDAS and SRB and other clinical books, whatever you have. The second set is to have a better understanding of how to approach a case, and that is where exactly all these modules are going to help you. These are not replacement to the textbook reading or SRB. This is SRB or SDAS. This is mainly meant to give you an orientation as to approach it, how to approach a case and how to answer a particular kind of question. See, your long case and short case, generally one long case and 2 short cases that are given to you, are all dependent how well they go. They are dependent on the fact how you approach these cases. You basically guide an examiner towards a certain area wherein you either know or you don't know. For example, आपने examination में कुछ ऐसी चीज बोल दी which was not relevant to the case. Now, what is going to happen is that the examiner will start asking questions on that. Suppose आपने STN के अंदर कुछ ऐसी चीज बोल दी which was more related to something else. ठीक है, the whole Viva will shift from solitary thyroid nodule towards some different section which you are obviously not prepared well with, and that is what leads to a disaster in PG or Viva examinations. And that is what you need to understand, that do not say things that you are not very sure about, and always be accepting with the examiner. There are cases wherein obviously, see, when you're a PG, you're very fresh into reading a lot of stuff. Maybe the examiner does not have an idea of the recent updates that have happened. Most of the times, 90% of the times, you'll face examiners who are very well educated, who are aware of most of the recent updates, much better than you, obviously. But there are chances that you might actually come across people who are not very updated with the stuff also. Then be humble, be graceful, accept what he's saying and move on. Do not start arguing with the examiner. That is not the purpose. Your purpose is to do well in the examination and maybe later on find out what he was telling was right or not. Most of the times it will be correct, right? So let us start with the course.